tell me what your name is, please.
Audrey Mason.
Audrey, you were telling me that you had how many strokes? 5 strokes. Okay. Can you tell me what happened for the first one?
Well, the first one, I went to the mailbox, and as I come in, I didn't feel right. And I knew it, and I knew something was wrong, so I went to the phone and called my sister-in-law and son, and I got myself to the couch, and that's as far I went out, and they come in, and they called the rescue squad, and they came and got me. And they called my husband, and he got to the hospital before I did. He was some concerned.
Wow. What kind of a sensation? Did you just pass out? Did you have any pain, or did you go down?
Headaches.
You had headaches. Severe headaches?
Severe headaches.
Okay. So you realized you were having a stroke when
I realized there was something wrong, and I knew something was happening, and I couldn't.
You didn't know what it was?
Nope, and I began, so that my speech, when I got to the phone, it was slurred, you know what I mean?
Yes, I do, because I had 3 TIAs myself.
Right.
So I know exactly what you're going through. Do you recall, you said your blood got thick. Did you have high blood pressure?
Low blood pressure, way too low. They
Way
couldn't
too low.
read it. They thought I was dead when they come to take me, because my blood pressure was so low they couldn't get it.
Okay. Did they give you any reason as to why the stroke occurred?
Just that my blood was too thick.
Your blood was too thick?
Yep. When they took the needle to take my blood, you know,
Yeah.
they pulled a blood clot right out on it.
Oh, my goodness. So that was the first stroke.
Right.
Okay, so what happened for the second one that you had?
Well, I went to the bathroom, and I just collapsed.
Okay, you just collapsed, like
Yep.
a heavy weight was on you and you couldn't stand up, or you
I just went down,
you just went down?
and then I come to, and I couldn't talk or holler, and I kept pounding on the, and my husband and son come with it, and they couldn't lift me. You know how
Yeah.
when you, and they got a sheet and rolled me onto it, and then they took me and put me on the bed.
Okay. How long between the first occurrence of a stroke and the second one? Was it a year? Was it a month? Was it a day?
Oh, it must have been 2 or 3 months.
2 or 3 months later. So the first one. What did they do to treat the stroke, the first one?
Well, they took me in and gave me shots and kept watching me, and they took and done things to get my blood thinner.
Thinner, yeah. Okay, did you go through CAT scans or MRIs?
Oh, yes, I had all of those routine.
Yeah. Did they take a lot of blood? I guess they took a lot of blood tests.
Oh, yes, yes, especially where it was
Yeah.
too thick.
So the only thing that they could really do was treat you to thin out your blood.
Right.
Okay, so as far as you know, there's no real treatment for stroke, is there?
No, no. Other than what they say, if they catch it soon enough, they can give you a shot and maybe help bring you out of it.
Yeah.
But we were 20 miles away from the hospital, so by the time you get there,
Yeah, by the time you get there, you know, there's no
There's no
time.
help.
Yeah. Did you have paralyzation?
yes, yes, and my mouth was off sideways.
Yeah.
And that trip, I went with a walker for about a week, but I couldn't handle that walker. I hated it, so I started walking the walls and hanging on to anything that I could hang on to help me get around.
Okay. Basically, did you go through any kind of therapy to come back?
Oh, yes, yes. I went through, what did they call, they had a special name for that therapy. And then I was in water therapy, I was in speech therapy, it was 3 different types of therapy.
Well, I don't really notice any paralyzation on your face anymore.
Nope.
How long did it take to go away?
Well, it started out, the insurance company would not pay for me to have my treatments. I could have 1 a week, but they wouldn't, they wanted me to come in more. So I'd go in once a week and have them show me what to do, and I did it myself, and the doctor said, "You're stubborn, probably that's what helped you, because you did it yourself."
That's great. Well, you know, there's nothing like willpower.
That's right, that's right.
All right, did you get, between these strokes occurrences, did you get dizzy? Did you have dizziness?
Sometimes,
You had dizziness and...
sometimes headaches, and sometimes I could feel my walking wasn't as good as it should be.
All right. Did you lose any coordination in your hands or your arms?
My foot, let's see, it was the left one.
What did you notice about your left foot?
I couldn't move and walk as good as I normally
Okay,
should.
but your hand was okay. You didn't lose it in your hand or your arm.
No.
Just your foot.
Right now, I'm having pains in my arm, and I've been to 4 doctors, and they can't tell me anything about what's going on.
Okay, so you said you had 5 occurrences.
Yep.
Well, what happened with the third one? Between the third one and the second one, how much time?
I don't remember the time.
I mean, was it a month or 2 months or 3 months?
Lord, sometimes it was up to 6 months.
Okay,
And it would affect me different. I would be sitting in a chair or different things, and it would just all of a sudden come right over me.
just like something went through your head.
Yep, yep.
Did they say that it was a piece of plaque that broke off and went into the brain?
Nope, they just said that I was having
TIAs,
TIAs.
but they didn't tell you what was causing them or what they might have
The
contributed.
only thing that they told me was the blood was too thick.
Blood was too thick.
Every trip.
Yeah. So, all right, so you had a third one, and then you had a fourth one.
Yeah.
Can you remember the time between those?
No, because I never paid attention, you know.
Yeah.
And then I haven't had one since then. But
Well, what-
I was not younger.
Well, how old were you, if you don't mind me asking, how old were you when the first one occurred?
I must have been about in my 40s or 50s.
Okay. And the second one, you were in the same age group?
Yeah,
The last one that you had, about how old were you?
about 60.
Oh, okay. So it's over a 20-year period of time.
Yep, yep.
And do they give
put
you
me on Coumadin for a long time.
Coumadin to thin the blood?
Yep, and I was on that for a long time. Then I was in the hospital down here, and the doctor said that he couldn't see that was the best thing. He thought maybe Plavix, and so while I was in the hospital, he changed me over to the Plavix, and I did marvelous after that. Never had any problems.
What does Plavix actually do?
It's a blood thinner.
Do you know the difference between that and Coumadin?
You don't have to go get your blood checked every week or every 2-3 days.
Okay. So that was the good thing.
Yep.
Now you haven't had an occurrence in how long?
Oh, must have been 50, 60.
I mean,
was-
10 years ago.
I'm 78 now, so.
Okay, so it was about what? You were about 50, 60s, let's say?
Yep.
So 70. So about 18 years ago was the last one.
Right.
And what did you do after the last one to not have another stroke?
I've been on the Plavix right along.
Plavix.
Yep.
Okay. And you haven't noticed any problems with the dizziness or
Nope.
anything?
Nope.
Did you have dizziness after it for a while?
Nope, nope,
No dizziness, no numbness
nope,
with the Plavix?
nope.
And has your blood pressure been good?
Yep, yep. It's normal now, but it sure wasn't back then.
Okay. Can you recall what your blood pressure was?
Lord.
That's okay. It's okay if you don't remember. I don't remember all the time myself. I know when I went into the hospital, I had a very high blood pressure.
Yep, see, mine was too low.
Yours was too low, and mine was too high.
Yep.
And have you had any problems with diabetes or anything
Nope,
else?
nope.
So now the Plavix seems to have solved the problem for you.
Yep.
Well, I want to thank you for taking the time to talk to me. Tell me your name again.
Audrey Mason.
Audrey. And thank you very much, and you have a blessed day.
You do the same.